So hello all of you and good afternoon. I'm Dr. Radhika Sheth from Luma Fertility. I'm the medical director and a consultant fertility specialist over here. We are here today to discuss about PCOS and how it impacts fertility. So let's start with a small poll over here. So has any one of you experienced or seen somebody experience any of these symptoms? So irregular periods, weight gain or trouble in losing weight, acne, oily skin, hair thinning, hair loss, or excess facial or body hair? Yeah, so we can see that we'll give it a minute. So yeah, so we can see that these are not very uncommon symptoms to see or uncommon symptoms to find. This is just many of these symptoms point towards PCOS, but it's not the definitive diagnosis based on these symptoms. So what is PCOS or polycystic ovarian syndrome really? So it is a hormonal disorder which affects ovulation. And if I may add the word, it's complex because we don't really know the cause. There are many postulates. So maybe it has a genetic origin, maybe there's some environmental influence, maybe it's a mix of two. However, it is pretty disrupting in many ways. The presentation is very varied, and it's not that it affects only the reproductive function. In India, we have seen that it's 1 in 5 women who's affected with this, and many women actually remain undiagnosed because the diagnosis has got proper criteria. We can't label anybody who has got irregular menses as PCOS or anyone who has got acne as PCOS. There are certain criteria which are known in scientific parlance as the Rotterdam criteria. So basically, we arrive at a diagnosis if the lady has any two out of the following three. One is high androgen. So androgen is the male hormone. So the way to pick up a girl with high androgen is clinical evidence as well as biochemical evidence. So biochemical as in lab work, a blood test, like for example, serum testosterone levels. So testosterone, most of us know already, is the male hormone, or serum DHEAS level. So these are high androgens, which is not a typical finding in a normal hormonal milieu. And clinical evidence would be features of acne or hirsutism, that is excessive body hair, or thinning of hair on the scalp, that is called female pattern baldness or alopecia areata. So these are basically evidences that the androgen levels are high. Second is that if she has infrequent or absent ovulation, so we know that the egg formation is once every month if the cycles are regular. However, if a girl has got irregular periods or fewer than 8 menstrual cycles in a year, then one can assume that she's not ovulating on a monthly basis as she should. And that is what we call as infrequent or oligo ovulation, or anovulation. That is where she's probably not forming an egg at all. Also, the third criteria is an ultrasound diagnosis where polycystic ovaries are seen. So what are cysts? They are small bubbles which are filled with fluid. So in polycystic ovaries, we have specific criteria. So not all cysts are polycystic ovaries. So if the number of small cysts or small black dots in the ovaries are more than 12, size of between 2 to 9 millimeters, we can label it as polycystic ovaries. So if any of 2 out of the following 3, what I just explained, of the above 3 are seen, then we can label it as polycystic ovaries. So as I said, not all cysts mean PCOS. Everybody who has PCOS also doesn't mean that they have necessarily cysts. Now, how does PCOS actually affect a girl? So number 1, it can affect ovulation. Number 2, it can affect fertility because it's affecting ovulation. And number 3, as I said, it's not just that it is affecting reproductive parameters. It overall has an adverse impact on the body's metabolism in different ways. So PCOS, here we are restricting our conversation mainly to the fertility aspect. I also want to say right at the outset that it doesn't mean that all girls with PCO are infertile. However, it can make the time to conceive or trying to conceive a bit hard. And why does that? What's the connection and why does it really become hard? Number one, we need to understand what PCOS is. So before going into this flow chart, some basics. So for us to form on a monthly basis, it's a interplay of different hormones. So there are many hormones in the female body, of which 4 are extremely important to make eggs grow. 2 are made by the brain, rather 3 are made by the brain. One is called FSH, another is called LH, and the third one is called prolactin. And the fourth one is made by the thyroid gland. So these 4 have to work as a team. They have to work in tandem. It can't be that one overpowers the other. It has to be all in sync. So generally, if we check the FSH and LH values, these are hormone tests, which are done by simple blood tests. So if we check the FSH and LH values on the second day of a girl's period, they should be more or less the same. Like, for example, if FSH of a girl is maybe 5, the LH value should also be hovering around 5. So maybe 5, maybe 4, maybe 6. It's not okay to have an FSH value of 5 and LH value of 10 or LH value of 15, but this balance is now tipped in favor of LH, due to which the egg formation, the process, the signaling to the ovaries is impaired, and the ovaries may have the complete potential to form an egg in terms of having the egg reserve. However, if the hormone signals don't reach properly, it can disrupt or affect ovulation to the extent where eggs may not form at all unless some treatment is given. So how do we know that a girl has got anovulation, or how would she know by herself? So as I mentioned earlier, irregular or absent cycles is a very common finding. And these hormonal imbalances not only affect the frequency of egg formation, it may not be once a month, it may be once in every 3 months, once in every 4 months, or in extreme cases, not at all. So it's not just the frequency, but it is also the quality of the egg that gets affected. Now, what do we mean by quality? So an egg has a natural tendency to be able to fertilize with a sperm and form a healthy embryo. Now, when we check girls with PCOS and we try to assess their egg quality, sometimes their eggs are hostile to the sperm and do not form embryos which are very healthy or which are very viable. But the right care or knowing what treatment is to be administered to what girl with PCO can actually improve fertility outcomes. So what is the right treatment? So it's basically a multi-pronged approach where lifestyle changes, I couldn't emphasize any more, give it any more importance, but it's something which is non-negotiable. If lifestyle changes aren't implemented, most medicines are unlikely to work. So it's a combination of a good diet, exercise, stress management, and proper sleep. Sleep is very important. Having around 7 to 9 hours of uninterrupted sleep on a daily basis is something which is very important. Why is stress? We are going in reverse order. Why is stress important? Because stress, if not managed, could lead to formation of hormones. For example, we have heard of cortisol, right? So if the serum or the blood cortisol levels are high, that could cause higher androgen levels. And we know that high androgen levels can cause all these symptoms of PCOS. And if the androgen levels are high, if the male microenvironment in the ovary is high, and it overpowers the female or the estrogenic microenvironment, there itself lies the flaw in egg development. What about exercise? Doing it on a consistent basis, maybe daily exercise of around 20 to 25 minutes, going for a good brisk walk, doing a little bit of weights, doing a little bit of muscle strengthening. So aerobic exercises, maybe just walking, jogging, brisk walk. All this could really help in go a long way in lifestyle changes for PCOS management. Now, coming to diet, this is something that we need to very well understand, that when we are talking about diet control, most of the times we see that girls with PCOS have a tendency to put on weight. Though it's not a rule that all girls with PCO are overweight or obese, we would say a vast majority of them are obese. Now, what happens is when there is PCO, there is more weight gain because of the hormonal imbalance. That causes the PCOS to get aggravated, and it goes like a whirlpool or a vicious cycle where if we don't break it at some point, it's going to lead into a crisis. So when we speak of weight management by dietary restrictions, number one, we should be advising girls with PCOS only to have whole foods. So for example, having whole wheat instead of maida or refined flours, having brown rice, having quinoa, having more of millets, restricting carbohydrates in terms of restricting potatoes, restricting starchy substances, no sugars, no sugar substitutes like honey, jaggery. So this is something which is very important. Everything that is generally very tasty, most of the times is not very healthy. So that's one thing that we need to remember. That doesn't mean that healthy things are bland or insipid. There are ways and means to make them good. Like for example, having processed foods or having ready to eat foods, they may be very yummy, but they're actually not very good for health. Also in terms of having high fiber. So high fiber is very, very good to cause a low or slow release of insulin or slow control or better control of sugars. So having a lot of spinach in the diet, having vegetables like broccoli, having certain nuts like walnuts, almonds, having certain seeds, so chia seeds or sunflower seeds, sesame seeds, all in moderation do help. What about fruits? So papaya, mangoes, not a great idea to indulge in, but having berries, having cherries, having apples, these are very good items to include in the diet. What should you avoid? So definitely processed foods, heat and eat, tear and open, then sugary beverages. So avoid having soft drinks, avoid having very sugary fruit juices. Do not have maida, as I said earlier. Do not have very stuff which has got saturated fats. Have a good protein diet. So a good protein diet includes lean protein. So that means having, if you eat non-veg, so having fish. So salmon is very good. Having chicken, that's very good. But try to avoid red meat. If you eat eggs, great. So egg white is very good. If you're a vegetarian, then tofu is a good food item to have to increase protein. So basically, having a good diet is a key stone in kind of turning things around when we speak about PCOS management. So as I said, many girls with PCO have excess weight, and controlling that weight can really, really help in getting all our hormone levels in order. And we have seen that, for example, if a girl is told to reduce even 10% of her body weight if she's overweight, around 20 to 30% of them would have restoration automatically of their menstrual cycles. Their hormone levels normalize to the extent that they ovulate without any treatment. So I think I've emphasized enough that lifestyle changes where diet and exercise are given extreme importance is something which is a pretty non-negotiable component of PCOS treatment. Now, sometimes lifestyle changes do not suffice. And when we are looking at girls who are trying to conceive with PCOS, there are different medicines that we may advise them so that they ovulate. So the commonly used ones are letrozole, which is something called as an aromatase inhibitor, or clomiphene citrate. So these are only given under medical supervision, not for off-label use. So these are just names mentioned for your information. And in certain cases, we give, along with these ovulation induction drugs, we give certain insulin sensitizing drugs, that is metformin or inositol. So if you ask me why insulin sensitizers, so there are two hormones which kind of go very high in PCOS. So one is the androgen, the male hormones, which I just mentioned, and second is insulin. So you may say insulin is associated with diabetes, but I can say that insulin, though common, PCOS and diabetes have probably a common forefather. So insulin is produced by the pancreas, and normally what happens is if I eat something, the food or the sugar or the glucose is absorbed, is digested, and it enters the bloodstream. The pancreas then get a signal and release insulin. The insulin then drives this glucose into the cells of the body, and this glucose is converted into energy. All of us need energy for different functions. For even simple things like breathing, for the heart beating, energy is needed. However, if for any reason there is insulin but the body's cells do not recognize it, the gates of the cells don't open to that insulin, they don't allow the glucose to enter, what would happen is that there is enough of insulin, but the glucose cannot enter the cells, due to which there is high blood glucose, due to which there is high insulin to try to compensate for the blood glucose, because the pancreas thinks it's not working enough. And because of high insulin, there are various damages that can happen. So one such damage is where the androgens in the body increase. Second is where the girl becomes a bit fat because of certain changes in the fat metabolism too. Third thing is creating a little bit of irregularity in other metabolic functions. Like for example, there could be heart disease over a period of time because of this. There could be hypertension, that is high BP because of this, or it could cause diabetes in the long term. So giving insulin sensitizers like metformin or inositol may open the gates of the cells to the insulin and to the glucose for better control. Now, in cases where we have given ovulation induction with these drugs, which I just mentioned, and where we track the follicular growth or we track ovulation and there is ovulation, but still she is not conceiving, or let's say she ovulates or doesn't ovulate properly despite the medication, in these cases, we need to kind of go to the next level of treatment, which is IUI or IVF. So it's not that everybody needs IUI or everybody needs IVF. IVF is test tube baby. IUI is a lower form of fertility treatment, which is simple, where we give slight different protocols to make eggs grow. Maybe not just letrozole, maybe not just clomiphene. We may add certain injectable hormones and we track to see if the eggs are growing. And once the egg releases, we take the partner's sperm, clean it by a method of centrifugation, and put the washed semen sample into the uterus. So IUI compared to natural has a much better pregnancy rate. So it's not everybody with PCOS that needs IUI or IVF, but this is an option which generally works wonderfully in these cases. So basically, it's not a cookie cutter approach, or it's not one size fits all. So the care or treatment protocol for each PCOS lady is different. What works for one may not be the strategy for another. So this is something to be carefully remembered. Once pregnant, okay, there are certain risks even in pregnancy when a girl has conceived with PCOS. So one is higher risk of miscarriage, higher risk of diabetes and BP, high BP in pregnancy. So how do we kind of tackle it? So early surveillance, early monitoring of blood sugars, of her thyroid levels, early scans, controlling weight before she embarks on the pregnancy is a great approach. So we do lifestyle support even during pregnancy. We give supplements like progesterone if needed. We continue the insulin sensitizers, like for example, metformin is known to reduce miscarriage rates. And with good care, the good news is that most PCOS pregnancies are healthy. Our approach at Luma is very personalized. So I need to kind of explain what differently we do. So number one, like how it should be, it's evidence-based medicine, which is led by science. There is personalized plan for each and every, there's a personalized plan made for each and every individual based on her hormone footprint, her cycle, how it looks, and her goals. So when we speak of goals, if, for example, she's not married and she has got PCOS, we know that over a period of time, the egg quality may go down, so we may offer her egg freezing. Whereas if she, for example, wants to conceive and she wants to try the lower forms of treatment like ovulation induction or IUIs, we do not jump into an IVF cycle straight. Secondly, there is ongoing support. We provide a dedicated care navigator who hands-hold the couple or handholds the girl throughout the cycle, throughout the fertility treatment process, so that there is no parameter which is kind of overlooked. The care navigator is a single point of contact, a fertility assistant, who not only coordinates with the lady as regards appointments, as regards blood tests or investigations, or administering the medicine or sending somebody to give the medicine. There are even emotional check-ins which are done by the care navigator from time to time. All the tests are done timed based on the cycle time for accurate insights. We do not overlook or we do not underplay the importance of emotional health and mental health. And that's where we have a very holistic program. We have a clinical psychologist on board. It doesn't really, it really matters a great deal when you know that somebody understands what you're undergoing, if that's the case, and there is somebody to kind of tide you over any such sort of crisis. Also, we have flexible formats for consultations, so we are always available in person. But for a person who is far off or finds it difficult to come all the way to the clinic each time, we do have online or virtual consults also. We also have a lovely app. It's called the Luma app, which probably is one of the first of its kind, where booking, consulting, everything can be done via the app. And the app is like a ready reckoner. It's like a chat GPT for fertility. So you put in your investigation, you get a record of what that investigation actually implies, the results of the test, what it actually implies, what steps, what proactive steps you should take, whether you should take it immediately, whether you have some time to wait, what different treatment modalities are available for a particular condition, so that you don't have to spend hours Googling and getting confused. So the Luma app is kind of a very hands-on app, which not only helps you to book and consult appointments or track your investigations, track your treatment records, but it also helps to get information about whatever fertility condition one has. So in short, PCOS can feel like there's so much to manage, especially when you're thinking about it from the fertility perspective. But you need to remember that you're not alone, you're not out of options. With the right support, proper clear guidance, and a clear-cut plan that's built around you, pregnancy is just a stone away. So when you're ready, we are here to help you to take the next step and help you to feel informed, hopeful, and to feel very positive about everything. So these are certain questions which I thought I would address before I can ask, we can throw open the chat to everyone. So basically, these are common questions. So a girl with PCOS may ask me, can I get pregnant naturally? So yes, in fact, I would say 30% or even up to 50%, 1/3 to 1/2 of ladies with PCOS do not need any fertility treatment whatsoever. They come to the gynac only when they know that they're pregnant. However, around 2/3, so 50% to 2/3, so 50% to 66% of ladies do need some form of fertility treatment. So is IVF the only fertility treatment option? Absolutely not. So there is IUI, there is simple ovulation induction. The key is to make the girl ovulate and to tell her to have relations at particular times in the cycle when we know that the egg is likely to be viable. However, if the lower forms of fertility treatment don't work, or in certain cases of stubborn PCO, where the ovaries are just resistant to all forms of treatment, in such cases, IVF can do wonders. What should I eat with PCOS? I think I elaborated on that some time ago. Is weight loss mandatory? So it's very important, especially in the obese category of PCOS, because if weight loss doesn't happen, then most of the medicines aren't really effective. The hormone requirements go high. The complication rates during pregnancy also could increase. Do I need to take birth control forever? So first of all, why should you take birth control if you're trying for fertility? That should be probably the question which is preceding that. So not all girls with PCOS want to get pregnant. I mean, PCOS is something which starts at menarche. It spans the entire reproductive life. So if a lady has already got a child and now she doesn't want a second child, maybe she has even conceived naturally. But if she has irregular cycles, unpredictable cycles, then we may put her on the birth control pill for some time so that it can cause some cycle regularization. Also, as I mentioned, that many side effects or many collateral effects of PCOS are the androgenic side effects. So acne or oily skin, hirsutism where there's extra body hair. So many of these birth controls are anti-androgens or anti-male hormones. So they work at a local level to reduce the acne. However, if a girl decides that no, my symptoms are under control because of lifestyle changes, or I now want to conceive, so that there's no question of taking birth control. However, the low dose pills which are available nowadays are pretty safe, even if taken for many years. The next question is, will PCOS go away after I get pregnant? So it will not disappear suddenly, but the symptoms may abate, they may reduce for a short period. The reason is that pregnancy is associated with certain hormone changes, and every lady reacts to those hormone changes in a different way. So PCOS does not just affect the reproductive life of the lady, it affects other metabolic functions also. So it does not just disappear after pregnancy. So do I need to treat PCOS if I'm not trying for a baby? Yes, because the effects of PCOS are long term. So it is associated with type 2 diabetes. It could be associated. It could be associated with hypertension, that is high BP. It could be associated with heart disease. It could be associated with certain forms of cancer also. Okay. It can all be picked up earlier, and it can all be the risk can be mitigated by proper measures. So even if you're not trying for a baby, it's always better to get everything in the body regularized or in a pattern or under control. So there is no cure for PCOS per se, but the symptoms and the metabolic levels can be kept under check so that the damage done is least. So can I manage PCOS without medicines? Very much if lifestyle changes are adopted, and if those lifestyle changes are enough to set the hormone rhythm back in line or in sync. So I think we are done with my presentation, and I would be very happy to answer questions if there are any.
Hi, Dr. Radhika. I had a question. Does PCOS affect my egg quality and like how often I ovulate?
Yeah. So PCOS could affect egg quality to some extent because the egg is forming in a microenvironment which is androgenic, which is more instead of it being estrogenic. So sometimes it is seen that these eggs are, especially when we are doing IVF, when we retrieve those eggs, we see that the pattern, the structure is not very integral. Also, the fertilization rates could be impacted compared to a normal egg or an egg without which is derived from a girl without PCOS. So, especially if PCOS is not corrected and if it's long standing, it could adversely impact egg quality.
And does it also affect how often I ovulate?
Yeah, so basically in PCOS, it's very often that you may not be ovulating regularly. It may so happen that you ovulate maybe once in every 2 months, once in every 3 months, vis-a-vis the normal of ovulating once every month. There are extreme cases where there may be absolutely no ovulation at all without any treatment. So, in fact, because that ovulation is not something which is very regular, that is one of the diagnostic criteria for PCOS.
Okay, thank you. Thank you so much, Dr. Radhika.
You're welcome. Okay, in the chat box, Hetvi has written, what fertility test do I need if I have PCOS? So we break it up into 2 or 3 sorts. So one is a test called AMH. So AMH stands for anti-Mullerian hormone, which is made by the egg seedlings. So that's number one. Number two, if the cycles are regular, on the second day, we do FSH and LH to see the balance. Number three, we also may want to check on the serum insulin levels, the fasting blood sugar levels, post-lunch blood sugar levels. And in cases where we feel that there are a lot of androgenic clinical presentations, we may also want to do the free testosterone levels or DHEAS levels. So in fact, at Luma, we have an entire panel, which is called the PCOS panel, which is a very comprehensive panel which encompasses most of the tests that are needed for diagnosis and treatment based on the values for PCOS. Yeah, you're welcome, Hedvi.
I have a question, Dr. Radhika.
Yeah, hi, Rashmi.
Hi. I just wanted to understand that if anybody is trying for 6 months and if nothing is happening, should I be worried?
So you mean if you've been trying to conceive since 6 months and there has been no conception? So there are different parameters that I would need. So if your age is more than 35, or especially if you're more than 40, this is regardless of PCOS or otherwise, then I think if you're the higher the age, then sooner you need to kind of consult a health specialist, a fertility health specialist, to know that everything is in order. However, if you're young, if you're maybe just 28, 29, 30, and it's been just 6 months, I don't think you need to panic. But it's always more reassuring to check if things are in order. It doesn't mean necessarily that you need to undergo any treatment, but just getting a fertility health check done is something which I would advise if there is even an iota of doubt. But if your age is more than 37, or especially if you're more than 40, I would say consult immediately, even before 6 months of trying.
Got it. Thank you.
You're welcome. So thanks a lot. It was a very interactive session. I love presenting. Sorry.
Sorry, can I ask a question?
Yeah, sure, Dr. Sidra.
Yeah, so I wanted to get my husband's semen analysis done, but he's not comfortable with the idea of going to the lab and getting it done. So, do you all provide anything like people can come home and get it collected or something like that?
Yeah, so if you can just give me your details, I'll have somebody from my team get in touch with you with the details, if that's okay.
Okay, yeah, after the session, I'll just give you my details.
Sure.
And I also wanted to ask that if your cycle is a 25-day cycle, 24 to 25 days cycle, and my periods are like for 4 to 5 days, like 4 days is like I get my flow and my bleeding, and then after 4 days it's gone. It's just like spotting or something. So on and off during my periods, I get acne. Otherwise, my cycle is pretty regular and everything is fine about it. My weight is 55 kgs, my height is 5'6". So that way, I'm not under the category of, underweight or overweight. And I work out daily. But what my question was that we've also been trying for maybe like 4 to 5 months and I'm not conceiving.
Okay. How old are you, Dr. Sidra?
I am 30, running
30.
my 31.
Okay. So 4 to 5 months. So I'll just talk about the fertile window concept.
Yeah.
So if you are looking at a 28 day.
Just a second. I also wanted to ask you that if my cycle is for 24, 25 days, when is my ovulation exactly?
Yeah, so you have to subtract 14 from that. So if
Okay.
you're got a 28-day cycle, then generally the 14th day plus minus a day or two.
Okay, from the back.
5-day. Sorry?
From the end, like when your cycle ends
From
from
the
that
end.
day.
Yes.
Okay.
So if you have got a 25-day cycle, it would be round about day 10 to day 12.
Okay.
So yeah, so basically there are different ways to check that. So if you just want to have natural and not visit any clinic, one good idea is to have alternate day intercourse
Right.
between day 8 to day 16 of your cycle.
Also, how can you track ovulation? Like, if you want to be really sure that you're ovulating right now, how can you track? Like, I know natural ways are like to check your body temperature and stuff, but
Right.
anything else that you can use a kit or something and get it
Correct. So
checked?
there are pre-stick kits available for the urine LH search kits,
Okay.
where, like for example, if in a 25-day cycle, I would recommend that you start checking from maybe 2 days prior to your expected date of ovulation. So
All
if
right.
you would be around 11th day where you're ovulating, maybe you could start from day 9.
Okay.
Fix a time every day.
All right.
Okay, the same fixed time.
Okay.
And the minute it shows positive, try that day and on the next day.
Okay.
But the kit has its own fallacies. So another good way to do is visit a clinic and do from the second day of a cycle, do a proper follicular tracking.
Okay.
Yeah, and there are blood tests also available, but a combination of one or two methods is considered the best.
All right, got it. Okay, so once we're done with the session, I'll just send you my details and you can also let me know.
Sure, sure.
Yeah. Okay. Thank you so much.
You're welcome.
Yeah.
Okay, thanks a lot everybody for attending on a Saturday afternoon, and we are at Luma more than happy to help. You can always reach out to us, and looking forward. Bye.
Thank you.
Thank you.
It was pretty informative. Thank you so much.
Thank you.